Hey everybody, welcome to our webinar this afternoon. We're going to give this like 1 minute for people to come in and then we will get started. Okay, the trickle of people coming in has slowed down, so I think we should get started. My name is Dr. Eric Ball. I'll be your moderator for today. My computer video is not working, so I do apologize for that. Welcome to our Emerging Issues Conversations. Very timely conversation today about trusted voices in the social media era. This has been a really difficult time for all of us, and I know it'd be beneficial for us to have some tips and tricks and ways that we can try to overcome mis and disinformation in these difficult times. So my name is Eric Ball. I'm a primary care pediatrician with the CHOC Primary Care Network in Orange County, California. I'm also the chair of the American Academy of Pediatrics in California and a board member of the California Immunization Coalition. And this webinar is sponsored by the California Immunization Coalition, in addition to the American Academy of Pediatrics in California. Some housekeeping. All the lines will be muted during the webinar. There is a Q&A box on the bottom of the screen, and that could be utilized to communicate with us. We will have a question and answer period towards the end, and we will use those moderated boxes to ask the questions of the speaker. And then this webinar, as all of our webinars, are recorded and posted to the California Immunization Coalition YouTube page, and the link is below. We'll show that link again towards the end. And with that, I wanted to welcome our speaker today, who's Dr. Alex McDonald. Dr. McDonald is a family physician, a sports medicine specialist at Southern California Kaiser Permanente. He's also the past president of the California Academy of Family Physicians and a co-founder of the This Is Our Shot campaign, which he will talk about. He's also very active on social media and advocate for immunizations and serves on the advisory board of the California Immunization Coalition. And with that, my disinvideoed body will hand it off to Dr. McDonald. Thanks for being here.
Thank you so much, Dr. Wall. I appreciate it. All right, let me share my slides here. And so, all right, there we go. Can you see my screen?
Yeah, you're perfect.
Perfect. All right, sounds good. Well, thanks everyone for being here. I appreciate it. I have tons of information I want to cover here and leave some time for questions at the end. I get very excited. I speak very quickly. I apologize in advance. But you know how you listen to recordings sometimes on like 1.5 or 1.7 speed? This one you can listen to on either real speed or like 0.5 speed. And so anyway, I digress. Okay, so let's jump in. I have no financial disclosures or conflicts of interest to disclose here. But I want to start with just some basic definitions. We hear the information, or we hear the term misinformation, disinformation, and thrown around a lot, and they're a little bit different. So I want to help kind of start with like information disorder here, if you will, and the types of information. So misinformation is information that is false, but it's not necessarily created or shared with the intention of causing harm. And so we think of like, satire here, or, things which, rumors which sort of spread and take on a life of their own, but they're not necessarily intended to cause harm. And then there's malinformation, which is information based on reality, but it's actually shared or weaponized and is designed to inflict harm on a person, an organization, a country. And then there's the overlap of these two circles here, and that's disinformation and information that is false and it's deliberately created to harm a person, a group, or organization. And so I'll be talking a lot about mis and disinformation here. But I want to kind of clarify and start with those terms with sort of false information and then intention to harm. And so misinformation is just, accident, not accurate, but then disinformation is really designed to harm. And that's kind of the main difference between those two. So I want to start with chaos and confusion is a feature, not a bug. Whether this comes to social media or the normal media or some of our most trusted health organization institutions, chaos and confusion is is a feature, not a bug. When it comes to health and the activation energy to say, get your flu vaccine or get your COVID vaccine, the energy required to do something is much higher than the energy to do nothing. And by creating confusion and chaos, the activation energy is lower, and people don't know what to do and what to believe, and so they do nothing. And unfortunately, that is a win for the people creating the mis and disinformation. And so I think it's important just to kind of throw that out there. But let's also think, when it comes to information, not all information and not all incorrect information is created equal, right? We have kind of low harm information. Down in the bottom here, we have sort of satire and parody. There's sort of false connection. There's misleading content, but it's really lower harm. And then there's sort of higher harm information where there's just purely false content, imposter syndrome, there's manipulated content. So there's lots of layers here, and so it's very challenging that we're dealing with lots of grays and not necessarily black and white, which makes things even more challenging and more confusing because again, not all information is created equal. Lastly, there have been really interesting studies about sort of social networks and social network analysis prior to the information age, and now in the digital space and in the social media world, there are these very complicated networks of groups, and breaking from sort of one social network and breaking into another social network can be very challenging. And so we are creating sort of these echo chambers, if you will, and a lot of times breaking through from one echo chamber to another echo chamber is increasingly difficult and very, very hard. And so then you just sort of people tend to get information from their own network, and it just reinforces their worldview, and they're more and more isolated from others' thoughts or ideas or perspectives, which is part of the challenge we're facing right now. And so, for example, when the CDC, has an information pause, or let's say they're spreading inaccurate or information based on politics and ideology versus on science and facts, it creates this void essentially, right? And so this is how we got here. For a long period of time, patients and people in the world have been thirsty for information. They've been thirsty for health information. And unfortunately, our healthcare system is not really set up in a good way. So you have the rise of health influencers, and you have the rise of information anti-vaxxers. And the reason that rose and the reason that was created is because there was this void of information. There was a void of trusted messengers. And then so you get the rise of the anti-vaxxers and the disinformation dozen. Again, I'm speaking to the Immunization Coalition, so I assume this is a relatively pre-selected audience. But there is a very, very robust, a very, very well organized, and an exceptionally well-funded network of misinformation when it comes around vaccines in general. You actually look at sort of the disinformation dozen, if you will. About 12 people or groups create about 65% of the anti-vaccine content out on the social media right now, and they make millions and millions and millions of dollars doing this work. And I think it's really important to call a spade. And again, this group is very well organized, they're very well funded, and they have a huge financial interest in spreading this misinformation and disinformation right now. And unfortunately, one of them is our HHS secretary. I'll just say for what it is. This has now spread, and we were really at the breaking point when it comes to misinformation, when it comes to vaccine in particular. There is mis and false and disinformation being spewed at the highest levels of our government. Even, I guess, this article in the New York Times, even pets owners don't want to vaccinate their pets for fatal diseases like rabies because there's been so much challenge here, and so many people just kind of questioning what has been decades worth of benefit to our health and our population. So this is where the science and the politics are really coming to a loggerhead and creating a lot of challenges. And unfortunately, the social media space is really amplifying this in new and unique ways, which we never really had to deal with prior. But really, the The problem when it comes to misinformation is this is a really interesting study done in 2018. So, 6 years ago, pre-COVID, that shows that misinformation it spreads farther, it spreads faster, it spreads deeper and more broadly than accurate or true information. And this is partially because of the fact that misinformation and disinformation is designed to cause fear and to cause worry and provoke emotion, which then obviously spreads farther and faster. So again, we're up against a really significant challenge here. And again, like I said, chaos and confusion is a feature. It's not a bug. Misinformation amplification really is spread through these echo chambers and algorithms, which kind of bump up kind of more sensationalized, more fear-provoking information. And then lastly, this really impacts health. This really impacts vaccination rates. This makes it harder for the work that we do in public health, in hospitals, in doctors' offices. And so we are really at a dangerous point right now when it comes to how this information is being spread and shared. Just as kind of a historical perspective about how vaccination recommendations and information used to be created, right? So you'd had stage one, you'd have FDA licensure, you'd have preclinical trials, you'd have phase 1, 2, and 3 clinical trials. You'd then get sort of a biological license application from the FDA, and then that very robust, highly regulated clinical trial data would be reviewed by experts within the Advisory Committee of Immunization Practices. They look at the evidence, they look at public health, they look at health equity, they make recommendations, and then that would go forward to become official U.S. immunization schedule and policy. This is really focused on improving the health overall, on evidence and evidence-based medicine. Now, unfortunately, the rules of social media now apply here. And so we have demonized pharmaceutical companies and the basic science research here. We have completely fired and replaced everyone on the ACIP and been replaced with non-experts. We have sort of junk, quote unquote, science. I don't even want to call it science. We have ideology really driving a lot of these practices. And basically, there's chaos, there's confusion, there's differing recommendations. And basically, this new system increases skepticism, it increases politicization of the process, it erodes trust, and it creates vague, inconsistent messaging, and as a result, no one knows what to do. So really the playbook on the social media world for the last 10, 15 years, 20 years has now infiltrated the CDC and some of our most trusted organizations or organized pieces. And so this is a problem far beyond all of us, and it's going to take all of us to really fix the issue. So hang on. Anyone depressed? I can't see your hands. But anyone out there feeling completely overwhelmed and completely depressed and have no idea what to do, and you just want to throw your hands up? Yes, I feel that way too. It's okay. But we can't do that because if you look at who people trust most when it comes to their health and the honesty, nurses rank number one. Shout out to all my nurses out there. Doctors rank number two, followed by pharmacists, rank number three. And then right down there in the bottom, there's members of Congress and Sith Lords. But the point is, when it comes to people who are trusted, who are seen as ethical, as honest, it really, really it behooves all of us in the healthcare field because we all have to do this work. And it can't be any one of us alone. It has to be all of us together. Regardless of political ideation or culture or socioeconomic incomes or educational status or you name it, people's own doctor is the person they trust most, regardless of kind of where you come from and your ideology or your background. Is your own doctor, not a doctor, your own doctor is the most trusted source of information. And that is really the secret sauce here that we all have to be a part of to help combat a lot of this information. And so, your doctor. So even more shout out to my primary care doctors. Again, I'm a family physician, but the most trusted clinician is really my own primary care doctors. Everyone's sort of fallen a little bit here in the recent years when it comes to who people trust. Pharmacists have fallen, friends and family, CEOs, journalists, everyone's fallen. However, primary care physicians and primary care clinicians have actually risen about 2 points when it comes to trust the most trusted source of health information. And so again, this is work that we all need to do. We all need to lean in. Now, my favorite quote here, or my favorite statistic here, the average patient spends about 15 minutes with their doctor, maybe twice a year, if they're lucky, maybe 3 or 4 times a year. However, the average person spends about 2 hours per day on social media. And so, how can we possibly compete with that if we're spending 15 minutes of FaceTime twice a year compared to 2 hours of social media a day? And so, this is where social media and our kind of interconnected world is absolutely critical for healthcare workers to lean in. If you look at news consumption on social media, it is increasing across the board, particularly in our younger individuals. Really something that we all need to be aware of and understanding where our people are getting our information. And then if you look, more Americans now than ever are actually getting their information from social media, but they're also trusting information from social media. They're trusting TikTok, and they're trusting that information just as much as they would other places, particularly the younger individuals. And then there you go. And then again, the trust, people under 30 now equally likely trust information from national news outlets as compared to social media, right? If you sort of look at the boomers there, they still mostly trust, the local news ranks number one, the national news ranks number two. It's been going down. Social media is a distant third there. But if you look at the people younger, 18 to 29, those numbers are scarily close between social media trust and sort of national news trust, which is a challenge to say the least. Um, Again, this is why social media really matters, because this is where patients are. This is where people are getting the information. And so in 2022, 58%, over 58% of adults had used the internet to look up health or medical information that year. And then almost 70% of young adults use social media to learn about and to discuss health topics. And so if they're using social media to get this information, and that information is not valid or trusted or accurate at all, that creates a huge challenge. And so people want this information. People are looking for this health information, and they're turning to social media. And so again, I'm biased, but I think we really need to reach people where they are, which is on social media, where they're looking for information. Again, by being present in social media, we can kind of meet people where they are. We can combat misinformation. We can help promote health advocacy. We can really build community trust. A lot of times, not a lot of times, every once in a while, I'll have a patient come into my office and they'll say, "Oh yeah, I saw that post you made about X, Y, and Z thing." And again, it may not change hearts and minds in that moment. We're not directly relating to the misinformation. We're not even validating it, but we're just putting out a good, accurate counterpoint to what's out there. I think really leveraging social media is important for thought leadership, for fostering connection, for amplifying voices and amplifying others' trusted voices. We can really create movements through social media, and then sharing those resources. For example, here, when the CDC had removed a bunch of information, and immunization information from their website, there was like an army of public health workers who had like grabbed that information ahead of time and shared it and put it onto sort of a decentralized hub, if you will, where people could still access that information. And so I think it's important we're collectively working together here, because that's really the key. The scary thing here, again, only about 12% of adults have health literacy really adequate to navigate the healthcare system and promote their own health and well-being. If you look at this chart here, Medicaid, older individuals, and Medicare are even less likely to have that information. And then the less information you have, the less knowledge you have, the more susceptible you are to falling victim to mis and disinformation and malinformation, as well. So we have a huge problem. Um, Now, when we're talking about social media, we can talk about any digital interconnected device you will, right? Obviously, the most kind of common thing we think about is sort of like, Facebook and Twitter and LinkedIn and TikTok. But really, any way that we connect asynchronously through a computer or through a device can technically be considered social media. But for the purposes here, I'll talk about kind of the basic traditional kind of social media platforms. Now, thinking about where people are now, different ages, different demographics, different genders, different cultures, different socioeconomic incomes, different education incomes will tend to gravitate towards different types of social media platforms. Now, YouTube wins across the board. YouTube is just head and shoulders above any other platform, regardless of any demographic. Facebook, and then sort of Instagram, Pinterest, TikTok. And so I always tell people, if you're thinking about using social media, start with where your audience is. If you want to reach younger people, maybe TikTok is the place to start, or Snapchat. If you want to reach kind of sort of, elder millennials, maybe Instagram or Facebook is the place to start. So really kind of they're tailoring your efforts to where your people are, where your community are. And so I always tell people that if we're going to do this work, we want to be targeted and we want to be specific, and we want to be smart about it, and not just try to boil the ocean, but being very specific and targeted based on where the people are that we want to reach. Okay, I'm going to talk about some social media examples here, and just kind of use a few people in myself. I used to do a lot of Twitter. I don't do much Twitter anymore. It's become kind of a cesspool. But I generally tell people you should pick two or three things that you sort of want to focus on. Now I'm a family doctor, so I have trouble focusing, so I do everything. But again, when I was using Twitter a lot, these were kind of the main six things I sort of focused on: family medicine, sports medicine, physical activity, lifestyle, health equity, and health policy. Those were kind of the main things that I really sort of focused on. Now, I've since switched a little bit more to Instagram, which is obviously more pictures and more visuals, and it makes it a little bit more fun. But this is kind of who I am, and I have created sort of a Instagram public persona it's professional. I'm a physician, but I also make it a little bit fun. I make it authentic, and I think that's one of the values of social media is you can make it personalized, and you can make it authentic, and you don't have to always be perfect 100% of the time. My social media is littered with typos, but that's okay, and I've learned to accept that, if you will. But here's the thing: there are no pictures of my kids on here. There's no pictures of my wife on here. This is all sort of public-facing information, and so that's the way that I've decided to use Instagram, mostly for these purposes. There's a bunch of great examples out here. I don't know if any of you know Bright Zhao here. They are a family physician at USC, and they have this amazing persona and have really sort of shown sort of younger millennials and Gen Z sort of what family medicine can be, what it can be like, addressing a lot of health equity issues and public health, and they're doing tremendous work. And then for people that don't necessarily want to put their faces out there, this version here on the left here is Medicine Explained, and this has again 1.6 million followers on TikTok. This is created by a couple residents actually, from UCLA. They started when they were in medical school. It doesn't have any pictures or faces of themselves. It's all just like little short animated video clips about medicine and about health, and so they can create sort of a I don't want to say anonymous, but it's not necessarily their personal face on there. It's more about the brand and messaging and education. Natasha Bullion is a good friend of mine who's doing amazing work. She is based out of Phoenix, Arizona. She works at One Medical and is sort of their regional West Coast rep. She does a ton of media work. She does a lot of advocacy work. She's actually on the board of Planned Parenthood, and so that's kind of how her sort of four buckets she uses when it comes to her kind of online social media presence. And then lastly, I want to kind of use the example of this is our shot in Vikunteya as an example of kind of what we can do when we are working collaboratively and create sort of a social media movement, if you will. So this was at the peak of the COVID pandemic, and COVID vaccines were just coming out, and we really wanted to help again elevate the health of the voice of the healthcare messenger, each individual, to help provide them the tools and the resources. Because again, it's not about a doctor, it's about your doctor as really the most trusted messenger. And so we started with about 15 advisors, partnered with 68 organizations. We trained almost over 4,000 people through online sort of training videos and interactive sessions, and then created billions and billions of digital impressions over the course of this is like end of 2020 to 2022, kind of as we were at the peak and the tail end of the COVID pandemic, really surrounding COVID vaccines. And our goal here really was to help train every single physician, every single nurse, every single pharmacist, every single healthcare worker to have the tools and the skills to have these conversations, to help create digital impact, to help impact patients and create a healthier world. This is kind of our theory of change. We kind of took active information about what was kind of spreading, what rumors, what myths, what mis and disinformation was trending on social media, provided some counter messaging to that, and then train those people to kind of give some of that feedback and some of that counter messaging. And then we got digitally engaged active health heroes ultimately. And so hopefully that's all of you. We worked very closely with the California Department of Public Health and did a bunch of webinars about how to have these crucial conversations about COVID-19 vaccines. And we basically showed that pre and post training, we really increased confidence within our nurses and our doctors and our pharmacists by over 30% to have these conversations and to share this information. Because really, a lot of us are kind of afraid to have these conversations. We don't even want to ask sometimes because we know it's going to create some tension, but that's okay. And I think, but not asking is not okay either. And so we need to do something. And then we had this unique moment in time here during the COVID-19 pandemic where people could really take a private active immunization and make it a public display and help lead by example. And there was just amazing pictures all across social media about people getting COVID-19 vaccines. And I encourage people every year to get their flu shot selfie and their COVID-19 selfie and share that online because it really made a big impact. And you never know when your message is going to go viral. You never know when it's going to resonate. And so this was a post that I did. A couple months ago, telling people to not fear Tylenol and to talk to their doctor if they had actual questions and not listen to politicians when it comes to medical information about Tylenol. And it got like 38,000 views, which is like the most any of my posts have ever had. And so you never know when your message is going to resonate. And so you have to just kind of keep sharing accurate information and keep sharing your story, and eventually something will stick somewhere. Okay, so moving on here. This is the call to action part. And so we all have to believe that vaccines are safe and effective. I know I'm probably preaching to the choir here, but we need to believe it ourselves. We need to understand this. We need to not start questioning our own expertise and their own science because of all the noise out there. So that's the first thing. We need to support each other and support our own efforts to do this work. And remember that vaccine hesitancy is not an all or none concept, right? There's people over here that are just going to accept every single vaccine no matter what. You can just say, hey, you should get your flu shot. Okay, great. Done, right? It's easy. And then there come people over here which they're not going to even listen to you. I can tell within 5 seconds when I mention the word, hey, you're due for your flu and your COVID-19 vaccine, I recommend you get them today. Within 5 seconds, someone's body language, I can tell if this is a conversation worth having or if I should save my breath for another day. Because we're not trying to reach those 20% on the bottom who are just completely entrenched in their beliefs and they're going to refuse everything no matter what. We're really aiming for the movable middle, the 60%, the people who have questions, who are unsure, who have concerns, and that's okay. That's very normal. We shouldn't just accept everything blindly. So that's really the group we're aiming to meet here, and understanding that we're all tired and we, especially in a busy clinical encounter, we only have so much time. But if we all do this work consistently, we all mention it, hey, I recommend your flu vaccine. It can make a big difference overall, because if we all do it consistently, it's going to send the message that's important and that it matters. Really, oftentimes when it comes to science and health information, it's really important to avoid jargon. A lot of people use a lot of jargon, and it just sort of people's eyes gloss over. And so using simple takeaway messages, simple language, using analogies and storytelling is so important and so critical. Those of us on this call, those of us in public health, those of us in medicine, we are convinced by data and numbers and statistics. And we start talking about p-values and NNT, like 90% of 95% of patients' eyes just sort of gloss over and they don't even care, right? We are not moved by science and data. Sorry, we collectively on this call are moved by science and data. The vast majority of the public is not. They rely on analogies and storytelling. We, unfortunately, in this nation, we don't really create policy based on data and science. We create policy based on anecdotes, right? How many times does it take like one sort of tragic story to kind of make a change or to create a new policy or new law? So it's really about storytelling. It's about analogies, focusing on kind of the so what, like why does this matter? Why does it impact you directly? No one, not no one, very few people really care about public health. They care about their own individual health and their family's health. So really focusing in on the individual and what it means to them, using visualize, using interactive tools. And then when necessary, you can always, maybe not in the social media space, but kind of using that sort of teach back method can really make a difference to check for understanding and can help create, fill in the gap sometimes because we think people understand everything we talk about. I think the most recent number I saw was patients retain and remember about 20% of what a physician tells them during a clinical encounter, and probably less for me because I speak quickly. But kind of using that teach back method whenever possible can really make a big difference when it comes to science communication, both in the exam room, in the office, in the nurse's office, in the pharmacy, on social media. And so these are the kind of the science communication tools we need to be thinking about much more readily because we're not trained to do this, right? We're not trained to communicate science, and we really need to do a much better job doing this both personally and publicly and professionally. For those of you, oh, I skipped a slide. No, okay, so for those of you who are interested, the Public Good Project has this trusted messenger program. And so you can grab this QR code or go to this website here where you can actually get some actual kind of evidence-based science communication training regarding kind of how to communicate with people and individuals. We're doing a lot of work with different organizations and kind of hospital systems to help educate healthcare workers because really this isn't about not about any one of us, it's about collectively all of us doing this work and really leaning into the trust. There we go. Geez, we really need to build trust. It takes a very long time to build trust. And again, as I said before, we as healthcare workers are really some of the most trusted messengers out there, and we need to all collectively lean into this work. The key here is don't do nothing. Do something, right? Whether it be recommending a flu vaccine, even if they say no, if you're simply recommending it, it makes a difference. And if we do that constantly all the time, eventually patients are being like, well, every single nurse, doctor, and pharmacist I've seen in the last 3 years has recommended I get my flu vaccine. So maybe there's something to this. Again, I like using this Finding Nemo School of Fish analogy, where there's a scene in the movie Finding Nemo where all the school of fish are caught in the net and they're all swimming in every direction and they're freaking out and they don't know what to do. And Nemo, right, the smallest among them, says, "Everybody swim down. Everyone swim down." All the fish start swimming in the same direction. They almost tip over the fishing boat. They break open the fishing net and they all swim free. And I think that's the key here is we all feel overwhelmed and insignificant in this landscape. But the key is if we all just do something every day, even no matter how small it is, we can all make a tremendous impact. And I think that's the key. So don't do nothing, do something. And when it comes to social media, I really think this is a extremely important and powerful tool that we can all have in our sort of our toolkit, our healthcare toolkit, if you will, to help reach beyond the four walls of our clinic, of our hospital, of our pharmacy, to really improve the health of our community and our patients everywhere, and encounter and spread accurate information. And so again, Don Berwick, I think, said it best. The work of a physician or a healer cannot stop at the door of an office, the threshold of an operating room, or the front gate of a hospital. Professional silence in the face of social injustice or anti-science is wrong. So you either have to engage or you're assisting in the harm. There is no third choice. And I think that's probably more true than ever, despite the fact that he said this nearly a decade ago. And so again, here are those sort of kind of six takeaways when it comes to using social media or even in-person communication strategies. Really meet people where they are, and I think that includes, your places of worship or your gym or your PTA or whatever groups you're a part of. You have to sort of meet people there because that's where they are. Tell your story, tell your patient stories, because stories are what's really going to move hearts and minds. And again, trust is really earned and demonstrated, and just continuing to hold that trust very dear because that's very important. That's something that we all have uniquely in the situation when it comes to health and health information. Lastly, we can't allow anger and fear to drive us and shaming others. We really need to create a place to invite people in. And when we become more divisive, when we become more angry, it really only sort of drives that 60%, the middle, the movable middle away. And so really creating a place for people that feels welcoming and invite them in, because if we just drive them away, we're never going to reach them overall. Um, Top-down information does not work anymore, especially when top-down information is distorted. Let's just leave it at that. And so really grassroots information, people like you, people who know you are going to much more likely trust you than someone they see on TV, if you will. And then really telling the truth and speaking up is really critical. It can be scary in this day and age, but we need to do it more and more. Um, and again, I like this quote from Dr. Nunes Smith. We need to double down on the importance of healthcare teams as trusted messengers, and it's really the key there is teams. It's all of us collectively working together to do this work. And so I know that's a lot of information. I know I spoke very fast, but we have plenty of time for questions now. And so I will stop sharing my screen here, and Dr. Ball, I'll turn it back over to you.
Thanks, Alex. I appreciate that. That was awesome. I apologize, my camera is still not working, so you're going to be solo on the screen, so I apologize.
Oh.
That was excellent. Some good questions in the Q&A, and then I have some from before as well. So, someone asked, have been working to upgrade my language to remove terms that may be triggering to some folks or
Mhm.
skeptical or just less effective in this moment. What are your thoughts about no longer stating, quote, safe and effective or even misinformation?
Um, that's a good question. We obviously we want to invite people in, and we want to use language which is inclusive, but we also don't want to whitewash our language so much that it doesn't mean anything anymore. So I think you have to sort of tailor that to the individual experience overall. So I don't think again, calling a spade is important. And sometimes when we sort of try to make everything vanilla, we end up losing the message. And so I think it depends a bit on the individual. It depends on the population you're trying to reach. So I don't have a clear answer for that, but I also would caution from using inaccurate terms or using terms which have been sort of weaponized for a political purpose either. And so that's a challenging one. I don't have a good answer for you.
No, it's okay. I have a quick story to tell. I was rounding in the hospital this morning, and in one of the hospitals I saw four babies, four new babies, none of whom received their hepatitis B vaccine at birth. They
Mm,
all refused it. Two of the four refused their vitamin K shot at birth. And one of those was a baby boy who they wanted circumcised. But
mm,
in their mind, the vitamin K shot was so bad that they chose actually not to circumcise their kid after I refused to do it because the kid did not receive vitamin K shot. So we're up against a lot, and that kind of, wears you down every day seeing that. Um, my question for you is, what do you think is driving this? What is the motivation? I mean, I know our motivation. Our motivation is we want kids to be healthy and we want people to grow up healthy and our adults not to die of vaccine preventable diseases. But what is the motivation of someone who puts out social media posts against vitamin K or against vaccines? It's not, uh, what are the motivations of those people?
that's a great question. I can't speak to any individual because I'm not inside their head or their brain. I know there are a lot of financial motives. Hey, don't trust vitamin K. You should trust my proprietary blend of herbs and spices for only 9.95. So I think a lot of time there are some financial um, benefits that these individuals have when they're spreading inaccurate information or kind of just poo-pooing science and evidence-based medicine. I think there's a lot of ego involved, particularly when it comes to social media and influencers. We know that there is a lot of they're sort of there's financial benefits of their own individual products, but then there's also, industry sponsored whatever. We know that the wellness industry is billions and billions of dollars. It's likely more than the vaccine pharma industry, actually, when it comes to sort of healthcare dollars being spent. But it's also being targeted to those who have the ability to pay. And so there's a health equity issue that comes into play here. So I can't speak to any individual kind of motivation of any individual out there, but I know there are a lot of deceptive practices. There's people trying to promote their own brand, their own products, and then promote kind of other products that they have some financial interest in.
Thanks. I the most recent issue of AAP News, which is American Academy of Pediatrics, like throwaway magazine that every pediatrician gets, has an AAP survey of pediatricians in it that just came out today. And in this survey, it talks about over 80% of pediatricians are concerned about misinformation.
Mhm.
51% uh, agree with the statement, hearing misinformation is a major source of stress.
Yep.
And less than 50% say they have the adequate resources to address misinformation. With that being said, over 80% of pediatricians also said my colleagues are an important source of support. So I think what you're saying is definitely borne out in that we're looking to each other to amplify messages and to get the word out. So with that, if you have probably most of the people on the call or most physicians, most clinicians out there are probably not comfortable being a content creator per se. So
Yep.
you do a lot of awesome content. You make a lot of videos. You put out a lot of good information. A lot of people aren't really comfortable doing that. But how do you support professionals and communicators like yourself on social media to spread the words that you're doing? Or how do I kind of edge into making content ourselves?
Yeah, there's that's a great question. There's sort of three when it comes to physicians, healthcare workers, NPs, PAs, pharmacists, nurses on social media. There's sort of three buckets I put people in. The first bucket is this the lurkers, people who are just kind of there, they're reading things, they're looking at things, but they're not really doing, they're not engaging, they're not really kind of doing anything other than just kind of looking. There are then sort of the people that engage, people that sort of like posts, or maybe they'll comment or they'll share or they'll repost information from someone. And then is the third bucket, and that's kind of the content creators. Now, we all can't be content creators. We're not all going to be comfortable being content creators, but I would hope we can all move up that the between one of those buckets, that kind of curve of engagement, if you will. And so, if you're just out there looking, maybe you can start liking and start sharing some posts. Maybe you can add a comment or two. If you're liking and sharing, adding comment, maybe you can try creating a post. I'd hope everyone could kind of move up that curve of commitment to some degree. And here's the other thing too, is we all can't we there's life and there's work and there's other things which kind of take away our time, and so we all can't be kind of at the top of that commitment curve. And so there'll be weeks where I post several times a week sometimes, and there'll be periods of time where I don't really post at all. And that's okay. So we can kind of move up and down that curve of commitment, if you will. But also at the same time, if we're all collectively doing this, then we're all somewhere on that commitment curve at the same time. And so we don't all have to be creating content. We can kind of rely on each other. If we're having a busy week and we're not on social media at all, we know that there are, hundreds and thousands of us out there who can then spread that information. Again, really finding people that you trust their information, you trust their content by sharing and amplifying their information, that can make a huge difference as well. Because we all, even if you have 10 followers, you never know where those 10 followers will then sort of share that information, and it can snowball from there. And that's the beauty and the power of some of these social networks. We don't all have to have, hundreds and thousands and millions of followers, but if we all kind of like and share and post good, accurate information, we can collectively make a huge difference.
I appreciate that. I think you talked about the void that's being filled by a lot of these anti-science people. I think some of the void is actually being filled also by our professional societies, and I encourage everyone to
Yep.
really get engaged and collaborate with your professional societies. I know retweet or whatever a lot of messages from the American Academy of Pediatrics, American Academy of Family Physicians, the AMA, NAPNAP. There's a lot of great organizations out there, and I'd encourage you to follow them and
Yep.
repost those messages. Good question in the Q&A is, a lot of this has become somewhat political because a
Mhm.
lot of this information is coming from an administration who's kind of, having these policies that are anti-science. So, how do you communicate and stay on policy without getting political and then people kind of shutting down your message that way?
Yeah, I mean, so I always, whenever I'm posting or thinking about information, I post it within the context of what's best for patients, what's best for community health, and what is best to help healthcare workers take care of those patients. And so that's kind of the framework I always use when it comes to my posts. And people can then sort of argue with that, but it's much harder to argue with that, and it makes them look kind of like a jerk when I'm trying to do say, look, this is what's best for my patients, this is what's best for our community, and so that's kind of the framework I always use. And so you're less likely to be subjective to criticism or you know internet trolls if you frame it that way. Now, the other piece too is if there are people out there who are trolling you and giving negative feedback, that I wear that as a badge of honor. That means I'm doing something right. That means I'm hitting a nerve. That means they're worried or they're concerned about what I'm saying because they know it's accurate so deep down inside. And so if I'm getting trolled from one of my posts, I see that as a good thing because it's gonna up the engagement. It's gonna up the algorithms are gonna spread that more widely, and so that's a good thing. When it comes to politicization, it's I always tell people, look, this is not about politics. This is about evidence-based policy, a science-based policy, and really kind of framing it in that context. And you can argue with me if you will, but really, if we look at the data, look at the science, then that's really what we need to follow. And politics has no part of it. This is not about politics, even though when you talk about Tylenol in pregnancy and talking to your primary care doctor or your OB/GYN about if it's safe for Tylenol in pregnancy, that has a political implication to it, but it's not about politics. It's about policy, it's about science, it's about data, right? And that's where we center ourselves. And people can say whatever they want about the politics, but when we start talking about, you know, political ideology as the grounding factor, that's where you get into problems. And so if we continue to talk about science, continue to talk about evidence-based information, that's going to give us a solid footing to stand on. And acknowledging that science changes. Science is not about knowing the truth. Science is about finding the truth, and being open and having the humility to understand that when science changes and data changes, then our policies need to change with it. And being okay with that, but not being okay with political ideology driving our policy.
So, talking about that political issue, I find that, most of us work for somebody or are part of an organization, right? You work for Kaiser, for example. Most of these organizations are incredibly risk averse.
Mhm.
And I'm sure Kaiser is not out there posting a lot about government policies because they're frankly afraid. And I think that's a lot of hospital systems and even pharma companies and things are not putting themselves out there, which leaves it up to, those of us who are individuals who are willing to do it. So how do
Mhm.
you toe that line between presenting this information without kind of rubbing your institution the wrong way or getting your hand slapped because your employer doesn't like what you're talking about?
Well, I've definitely had my hand slapped before, so I'll put that out there right now. But I think it's about building relationships. So all of these organizations, whether it be a small practice or a behemoth healthcare firm, we all have people who are running our kind of our media, our public affairs accounts. And so building relationships with those people and letting people know, hey, I am here because I value science, I value evidence, I want to keep our patients healthy. We are aligned in our goals. So building those relationships early and letting people know kind of what you're doing, what you're about. And so that way, if they get some weird complaint or they see some post, they'll be like, oh, that's just Alex. We know him. And they can reach out to me or whatever. And so I think it's about building relationships, it's about building trust. It's also about finding an employer or an organization that aligns with your personal values. And so, again, Kaiser Permanente and Southern California Permanente Medical Group are really evidence-based. They're really based evidence. They really base the health on trying to do what's best for our patients. About policy, vaccines are a huge piece of that, and that aligns very much with my personal values. So I think finding an organization which aligns with your values is really important. And then as you do this work, you're less likely to kind of run into challenges because you're already aligned from the start.
So moving along those lines, I mentioned before that I had a bunch of babies this morning, and their parents did not kind of do any interventions for them. So one of the babies I saw who did not receive vitamin K or erythromycin or hepatitis B vaccine, the mother was a physician's assistant, and I asked her like, what was her rationale, and she wasn't able to give me a concrete answer to anything. It was a lot of very nebulous, like I read this somewhere, there's quote new evidence somewhere and things like that. So there's a conversation going on in the Q&A right now by some people who are talking about how they're having a hard time getting their staff to get COVID or flu
Mhm.
vaccines.
Yep.
And then you have basically, you're being kind of undermined from within, where it's hard to give uh, kind of strong recommendations to your patients if your own colleagues are not, practicing what you're preaching. So any advice to those folks?
Yeah, and then that's a challenging one. I mean, I think we're all leaders in our healthcare systems, and so leading by example, like I said before. So getting your seasonal vaccines, sharing it, publicly, encouraging your staff to also having those conversations. Like, well, for specifically your back office staff or your nurses or your pharmacists, if they're not vaccinated, asking them why. Well, why aren't you vaccinated? Help me understand, and not judging, but kind of approaching it with curiosity, right? Be curious, not judgmental. Because a lot of times people are trying to do what's best. They ultimately want to do what's best for them, what's best for their health, and what's best for their families. And again, in this day and age, they're worried and they're concerned. And so again, that personal relationship and that storytelling and provoking emotions and having those conversations is really going to help you better understand and help change hearts and minds rather than, again, presenting data and p-values and whatnot. So I think it's all about relationships. It's all about having conversations, and it's not always one conversation. Sometimes it's multiple conversations. Let me give you an example. Last 6 weeks ago, I had a 6-year old for a well child visit. So the mom was my patient also. And I can tell you for the last 6 years, since I've taken care of this child, they have never had their flu vaccine. And at the end of the visit, I said, hey, you know what? We have flu vaccines available. I recommend you both get your flu vaccines. And the mom kind of like let out the sigh and was like, oh, I knew we were going to have this conversation. And because I have literally recommended the flu vaccine for them every single time I've seen them for the last 6 years. And she had a couple questions, and I answered her questions. And she said, you know what, Dr. McDonald, you've taken care of me and my family for 6 years. You've done such a good job. We really value and trust you and your opinion, and we're going to get our flu vaccines. It took me 6 years to get there, but I got there. And I think that's the importance of just being consistent, and cheerful persistence is going to get us a lot farther than fear and intimidation, and building trust and having those conversations. It sometimes takes 6 years, but it's worth it.
I love that story. That's really great. I think when we teach vaccine communication, kind of one of the takeaways is you don't have to get them vaccinated that visit. You just need
Yep.
to kind of move the ball down the field a little bit, and then hopefully, they'll come around in the end. We have time for one more question. So health literacy really low. So the average American has very poor health literacy. And sometimes I think those of us who are in healthcare have a hard time getting that mindset because we kind of know what we know. So if I take my doctor hat off and think about like, we're going to have a ACIP meeting and they're going to be bashing on the hepatitis B vaccine in a few days. And if I think about it, like, wow, yeah, why are we vaccinating like newborns against the sexually transmitted disease? That doesn't make any sense. And if I'm not a doctor, like that's a very logical argument. And for
Right.
me to counteract that argument it's really kind of complicated. I have to kind of go into like ways of transmission and, maternal transmission and testing efficacy and things like that. So how do you do that? Like, how do you preach to an audience that really has a low level of health literacy?
Yeah, and I think this is the challenge also is it's the lie gets around the world before the truth can get its pants on. And so I think part of the information is this information and misinformation and disinformation is designed to sound like it makes sense and to be simple and to be very understandable. But unfortunately, the truth is a lot more nuanced, and the truth takes a lot more kind of background and experience. And so we're already fighting an uphill battle. But I think sometimes just sharing accurate information, being like, well, do you know that hepatitis B can spread from household services? I'm like, oh, I didn't know that. And so sometimes just providing small, digestible nuggets of information, and not trying to, again, explain the entire epidemiological process of hepatitis B transmission within a single visit. Because, again, eyes gloss over and you lost them. But kind of finding what that nugget is, that's kind of the biggest barrier for them, and providing a single counterpoint, and demonstrating like, look, that's not actually accurate. Here's that accurate information about that single piece of information, as opposed to trying to dispel the entire thing at once.
That was awesome. Alex, thank you so much. I want to close with a comment that one of the questioners asked that says, these webinars are so helpful because with all the loud deniers, skeptics, etc., it's easier to feel alone in this work. And I agree. It sometimes you feel alone. You feel like you're being bombarded on all sides by people who are actively trying to undermine what we do in public health. And I do appreciate you, Dr. McDonald, and everything you do and everything the California Immunization Coalition does to bring us all together. So thank you for your time. I really appreciate that. When we are done with this webinar, there will be a survey which will pop up on your screen. We would love if you could fill that out. It helps us to figure out future webinars. We've been doing this multiple times a year now since the pandemic, and I hope that it's time well spent for you. Um, and then we have a few more educational things coming up. Dr. Jeff Silvers, who's an amazing communicator, will be giving an education hour from California Immunization Coalition next Monday at noon. You can register using that QR code or on the CIC website, and he'll be talking about navigating respiratory virus season, which I well know in my office is very much underway right now. And then, if you are interested in learning more about this, please attend our California Immunization Coalition Summit. It is every year. This year, it's June 3rd to 4th. Great education. Dr. McDonald was actually one of our speakers last year. And we always have amazing speakers. And go to our website to learn more, save the date, and registration will be coming out soon. And then finally, if you want to see any of our previous emerging issue conversations, please go to our YouTube channel or check us out at the California Immunization Coalition website. With that, I want to thank Catherine Flores, Cameron Lawton, who are the amazing team at the California Immunization Coalition. I want to thank Alex McDonald. I am, again, Eric Ball. I apologize for lack of video today. And thank you all for joining, and thanks for all you do for keeping people healthy. Have a great day.